Okay, so we are doing a Foley catheter insertion. We received an order from Dr. Smith for Mr. Johnson to have a placement of Foley catheter indwelling inserted. And from here, I'll verify my patient's name, date of birth. Can you give me your name and date of birth? Great. Do you have any medication allergies or any allergies to latex or substances like alcohol? Okay, great. So, at this point, I will perform hand hygiene, wash my hands, place a new pair of gloves on, and assist my patient into a supine, relaxed position for the entirety of this procedure. I have my basin. My patient's already reclined, so I have my basin here of warm water. I've exposed my patient's penis, and we are going to perform pericare on him. So I'm going to take my basin of water, apply soap, and clean the meatus while pulling down on the foreskin in a circular motion, making sure to get all his penis clean. And then the basin with clean water, clean warm water. Wipe the remainder of the soap residue off. And a clean rag will be used to dry his penis. Okay, so now that pericare has been completed, I'm going to discard my gloves, perform hand hygiene, washing my hands, and clearing my work surface so that I have enough room, enough space to perform this next check-off. So, to begin with, I'm going to take my catheter kit out of its bag, and I'm going to set up this bag as my trash bag. Okay. So now it will sit up on its own and allow me to discard any of my extra materials without crossing my sterile plane. In the bag also was included a waterproof cloth for our patient. I'm going to set that underneath Mr. Johnson just so that I do not get his bed or area any wet. And then I'm going to open up my kit and frame. It is going to be opening up and away from me, maintaining a 1-inch parameter of non-sterility, and removing my sterile gloves and opening up that last corner. So I'm going to don my sterile gloves. By doing so, I'm going to open up my paper, opening up my dominant hand first. I'm going to use the cup and insert and cup this glove, insert, and straighten up any extra that I may have looped over. Okay, so from here I'm going to safely discard my extra that I do not need. This is a sterile drape that we will drape over our patient's penis. Right, it has been placed, and I'm going to set out and move our tray and get it set up. Set out our kit so it's in frame. Okay. Alright, so to begin with, I want to take my syringe of saline and apply it to the site that inflates the bulb, to our connector. For demonstration purposes, I'm opening up my lubrication, prepping my tray, discarding in my bin, and opening up my alcohol swabs for cleaning and setting them out on my tray to be used. Okay, so from here I want to open up and take out my tubing, which I'm going to remove very carefully and twist this around my hand to ensure that the tubing does not fall or get contaminated. Okay, from here it'll be placed into my lubrication, and for a male I want to lubricate it 5 to 7 inches, and I will do that right now. Okay, so we've got our tray set up. So from here I want to take my non-dominant hand, and this hand will be dirty and not touch anything in my sterile plane again. I will take my cleaning swab, one of them, and I will clean from the tip to the base in a circular motion, making sure to pull back any foreskin, discard my second swab, clean, circular motion, discard, and my last swab to clean in a circular motion and discard. So with my non-dominant hand not moving, and my dominant hand now is going to be what will insert the tube. I have it lubricated for 5 to 7 inches, and we will begin inserting the tube. There we go. We will insert the tube, asking the patient to remain in a calm position. Just rest and breathe for me. Rest and breathe. Okay, so we have inserted 5 to 7 inches, and we are getting urine flow returning. I'm going to hold and dump my non-dominant hand, the catheter, in place, and use my dominant hand to insert the solution into the bulb, inflating the bulb at this time. Okay, almost done. And there we go. So it has been inserted. What I'm going to do is I'm going to gently tug back to make sure we have placement and it is secured. It's not going anywhere. I want to take this tubing and tape it down and secure it to the patient's thigh or abdomen, whichever is more comfortable for him at this time. Okay? And I will anchor my tubing to the frame of the bed below the level of the patient's bladder, but not on the floor. So that has been placed. Okay, and at this point my drape can be removed, and all of my other items can be discarded. Okay, I'll take my gloves off, perform hand hygiene, sanitize my hands, and also in this demonstration I'm going to be performing catheter care for my patient. And by doing so, I would introduce myself. Hi, I'm here to do catheter care, and make sure that my patient identifies himself, perform hand hygiene, washing my hands. I would apply a clean set of gloves. I would set up my basin of warm water and my rags and my dry cloths in order to clean him well. I would take my warm water, my rag, apply soap, anchor the penis down, and I would clean in a circular motion to the base of the penis from the tip, pulling back on any foreskin to make sure that all is exposed. And I would discard, and I would rinse in the same manner using a clean rag without soap. And then I would use another cloth to apply a little soap and anchor the tube with my fingers and clean down the tube by 4 inches. And then take another clean rag to clean down the base of the tube by 4 inches. And drying. In drying, I would take a clean rag and dry both the penis and the tube. And that is catheter care and catheter insertion with Pericare.